Well, first of all, I just want to say humongous thank you to the entire Globalizer community and to the Phillips Foundation teams, because even though that was 6 years ago, um, I would say the reflections and the shifts that I'm sharing today really emerged from that work, that intensive work that we did with the team back then, and of which we've really felt the rippling effects and been able to see the rippling effects on the system in which we function. So for me, I guess one of the biggest mindset shifts coming out of Ashoka Globalizer was really thinking about scaling. It's kind of moving from thinking about scaling mDoc, and mDoc provides virtual self-care, AI-enabled health coaching, to thinking about scaling the conditions for self-care, right? So not just about scaling our organization, but really looking much bigger and much deeper about what those conditions for self-care and quality tech-enabled person-centered care were, and what it would take for that to really kind of create a system and a movement of change. And so the accelerator really helped me understand that systems change is it's less about controlling a solution, especially when you're focusing on a tech-enabled set of solutions, but more about working to co-design the conditions under which many different actors and stakeholders can carry that broader mission and broader vision forward. And so I think before the accelerator, we were just honestly at mDoc, we were so focused and maybe, and I would say in some ways it was unconsciously operating from the idea that impact comes primarily from growing the organization. So, oh, we want to have more reach. We need more staff. We need to kind of think more about digital infrastructure. We need to think about more in-person tech-enabled hubs because we leverage a phygital approach, more programs. And Globalizer really helped us think differently. And I would say it was a real push for us around thinking about what are the root conditions that prevent millions of people across the world from accessing or unlocking the agency that they have and accessing continuous, respectful, person-centered chronic disease self-care. And how do we influence those conditions through partnerships with government, partnerships with organizations that focus more on social determinants of health, like financial literacy, partnerships with organizations that look at behavior change more systematically, or help us think about providing incentives in systems that drive motivational change, or with technology and with community partners. And so that fundamentally changed how we designed our strategy. And so today, we really kind of focused on galvanizing a movement around self-care in partnership with stakeholders that we had never thought possible. And in doing so, we've now reached over 170,000 people, primarily all low income, primarily women. We've trained over 16,000 healthcare workers. We've set up several tech-enabled nudge hubs and working hand in hand with the community that we serve and hand in hand with government, scaling systematically and continuing to impact people that translates into health outcomes. One of the health outcomes I'm particularly proud of is reducing essentially hypertension, significantly reducing blood pressure in people living with hypertension, and that translates into a reduction of by 30% of their likelihood of premature mortality aligned with the SDG 2.4. So that's just one of many indicators that we continuously track. And again, it is all because of the Ashoka Globalizer broader team pushing us and thinking way beyond ourselves and really understanding the power and the rippling effect that systems change can have. So thank you so much.